welcome back to Body Beautiful. I'm Janelle Marie. With us today we have plastic surgeon Dr. Joseph Mele. We are talking about a bunch of topics. We've gone through a lot. Our last one is lip augmentation. Dr. Mele, I have a feeling this is very popular.
It's very popular.
Lips today.
Especially since we have better fillers and collagen.
That's right.
You know, once hyaluronic acids came out, even my patients' husbands, boyfriends would say, I like this stuff better, not because...
Wait, what's hyaluronic acid?
Hyaluronic acid is like Juvederm,
Restylane,
okay, the fillers.
Perlane. Gotcha.
That's the generic term. So it's a normal part of the skin.
Yeah.
And they purified it so that we can put it in. And the nice thing is it doesn't disappear immediately. It takes 3 to 6 months.
Okay, so it stays there for a while.
For it to go away. But my patients' husbands and boyfriends would say, I like that stuff better than collagen because when I'm kissing on her, it's soft. It feels like a lip. Whereas the collagen was quite a bit firmer and it went away faster.
So the before was putting collagen in and now after is fillers?
Yeah, and we've had them for many years, so it seems very predictable. Okay. Very, very safe.
But, you know, you see Lisa Rinna, you see all these people with the permanent lip, it seems. So what is the permanent lip?
Yeah, there's really no permanent
No,
lip
you don't want to basically
Lisa
do
Rinna
that.
had silicone in her lips.
Okay.
And she's been very straightforward
yeah, absolutely. She says it all the time.
She's happy she did it. It made her career, but she wishes she had in other ways because eventually she had to have it excised.
Yeah.
And I've had to do that. It's not fun.
Okay.
Sometimes even the muscle of the lip is dead from the injections of the silicone. It's not a good thing. But I think the most common way for lip augmentation these days is using these types of fillers. Even though they're temporary, it's easy. You come in the office. It might be a little extra swollen for a day.
They're going to go away.
You hate it. It goes away.
Let's take a look at some
But the biggest problem again is sometimes it doesn't last as long as we want it to. So,
so
what I've brought is pictures of alternatives, other ways to do it.
Okay,
so this is someone a little bit older, thinning of the lips, had used fillers. For her, it just wasn't lasting long enough.
Right.
So what I've done is actually advance the vermilion, the pink part of her lip, out onto the skin.
Oh, you did?
So if someone has a longer upper lip, you know, more skin between the nose and the vermilion, the red part of the lip, it's an option where we can advance it up.
That's great.
The downside is there is a scar. There's a scar there between the lip and the skin.
But you can't really
and sometimes it's a little more noticeable than we want it to be. So if I have someone who's always wearing lipstick, I'm not as worried about it. If someone never wants to wear lipstick, I'm going to worry. I'm going to worry that maybe that's not the best choice.
Let's go to another picture.
So, and this is from the side. So again, you can see where the lip is kind of just barely making it to the front.
Yeah, very thin on the top there.
Afterwards, I've been able to bring it up and around. And you can see the skin distance between the nose and the lip is decreased because I've covered that skin with the vermilion.
Downtime on that, what do you think?
So swollen a week or 2.
All right, let's go to
be a little
picture number 3. So just swollen. That's beautiful.
So this is a dermal graft.
Oh, what's a dermal graft?
So dermis is the deep part of the skin.
Okay.
So a lot of times I'll do this with facelifts. Now she was a little younger, didn't need a facelift, but if I'm doing a facelift, there's extra skin we're removing from in front of the ear. I'll take the outer layer off, you make a dermal graft out of that, and you can customize it so it's a little bigger at the end, smaller in the middle for the upper lip, and basically bury it under the lip to give volume.
That's fantastic. That looks really natural and good. And it looks like the lines around her mouth have gone away also. That's 2 years out?
And it still looks good.
Does it get rid of the lines around your mouth when you do that? Or
if they're fine, it does, because it adds volume. Just like we get with fillers, we can make it go away. Downtime could be a couple weeks with that.
More on
could
that?
be a little bit more. And if you're not having a facelift, we got to pick somewhere else to steal it. So sometimes we'll steal it from another scar if they have a previous surgery, or the fold under the butt works really, really well.
I like
so that's a good place to steal it from.
All right, this looks beautiful as well.
This is a VY advancement. So what I've done is take the mucosa from the inside of the lip and push it out.
Mucosa?
So mucosa is the lining of the mouth.
Oh, okay.
The backside of the lip.
Brilliant.
And we have different words for everything.
I know, but
essentially what I'm doing is making an incision inside the lip that looks like a V, pushing it forward and making it into a Y.
It looks fantastic.
So it gives you more of a pout.
We only have 30 seconds. What about fat grafting? Can you do that to lips?
Fat grafting, not a huge fan of fat grafting. All right. Sometimes it's lumpy and firm, and these others are much more predictable.
We gotta go. Unfortunately, it's time to go. Thank you so much, Dr. Mele. For more information on Dr. Mele, call 925-943-6353 or go to the web, drmele.com or sanfranciscobreast.com. Thank you for joining us on Body Beautiful. We'll see you next time. Dr. Mele, always a pleasure.
Nice to be here.
Thank you. See you next time. Bye, everybody.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.